Recording. Yes, I am recording. There we go. So it is Breast Cancer Awareness Month. We find ourselves in the month of October. For me, I'm having a mild freak out because I've booked my first ever mammogram. And it is something that I think I've been dreading and fearing for most of my life. Unfortunately, I do have family members from my mom's side and my dad's side who have breast cancer, but they're survivors. And I think that's a wonderful thing. But it's always that fear of the unknown. I'm catching up with two incredible women who I absolutely admire, who are going to walk us through Breast Cancer Month specifically and how their industry is affected. Of course, we're also talking Optiphi, because it is because of Optiphi that I did the breast risk assessment. And it's because of that particular assessment that I needed to book my mammogram urgently. I want to start off with first Dr. Liana Volkwyn. She is really someone absolutely incredible, and I cannot wait for you to get to meet her. Dr. Liana Volkwyn, welcome. Thank you so much for tuning in. You're in this industry. Tell us a little bit about your medical journey and what exactly you do, your specialty.
Afternoon, Suresh. Thank you for having me today. It's an honor to be on your show. And I think thank you for highlighting such a very important cause. So my medical journey actually is Pretoria based fully. I did my undergraduate and postgraduate studies in Pretoria. I did my internship in Cape Town, and then I came back. I did my ComServe, and then I worked for neurosurgery for a year, and then I moved over to plastic surgery, and I started specializing in plastic surgery. So I studied medicine thinking that I would actually become a neurosurgeon. But in my first year of medical school, my mom was diagnosed with breast cancer. So she underwent the whole process of mastectomies and reconstruction, and that kind of piqued my interest, but it also got her to motivate me, because she was also like, please, you need to help women just like me. So there is a definite emotional journey to why I became a plastic surgeon. But once I was in the specialty, I think it's an amazing, innovative, revolutionary specialty and especially for a woman. Yeah. And I love what I do. I love being a surgeon. Don't get me wrong, not every day is easy, yeah. But I love what I do, and I love what I'm able to do with my hands and how I'm able to change people's lives for the better.
And I think that's exactly it, because, I mean, you hear the stories of things going wrong under these procedures, and especially for women who, if it's specific to mastectomies, the last thing they want is to have this being botched. You know what I mean? They've already been through so much trauma. So having somebody like yourself you're a miracle worker, I'm sure. And so, wow, we thank you for that. We're going to talk about your journey. And before I get there, I want to quickly ask you in touch base, COVID. How have you coped from a mental perspective? How's it going with your practice? This must be a crazy time for you.
It's actually very stressful, because if you take yourself back to level 5 lockdown, we're not technically seen as essential services, being a plastic and reconstructive surgeon. You know, the amount of trauma work that comes the way of a plastic surgeon is very minimal on the scale of trauma that comes in. And with everybody not drinking and staying home, nobody really being on the roads, we really saw very, very little trauma. So essentially, throughout level 5, I couldn't work.
Sure.
I was stuck at home, and I think it's the first time since I've started in private practice back in 2015 that I've had a month where I literally did nothing.
And there's only so much banana bread one can bake. Okay.
I went on a baking and cooking frenzy, but it's, as you said, it gets to you after a while. You feel very redundant, and yes, it's a difficult time. We also, with links with association, slowly, gradually started working in our practice again. You know, the rules were very strict. Yeah. Things are still very different. We, only allowed a certain amount of patients in the waiting room, screening, and also from a surgical perspective, no patient can get surgery without being tested for COVID prior to that.
And I always think about, like, yes, I can think from a surgeon's perspective, but can you imagine women living with breast cancer? Because the cancer doesn't stop at some point. It doesn't go, whoa, we're in the middle of COVID, let's not get any further. So it must have been quite traumatic for many men, many women not having these surgeries available to them.
Yes. Well, we weren't doing any major reconstruction, because also we didn't want to unnecessarily admit patients to ICUs. Yeah. So most patients, especially the ones coming through my practice, had a staged reconstruction, which was planned. Mastectomy still, the oncological management still had to continue. Yeah. So they got their mastectomies. Some patients obviously get their chemo before the time. Some patients have their chemo afterwards or just go into medication. But once the mastectomies were done, we would put in like a tissue expander, which is basically like a placeholder to maintain the skin envelope while we're waiting to do the reconstruction, hopefully next year. But with things are obviously easing up now in level 1, our numbers are dropping, which is obviously good. So we can do elective surgery again. So now we're starting to finalize a lot of our reconstructions.
Oh, fantastic. Well, I'm happy to hear that. When I was reading through your profile, I was so taken aback because you know, you never imagine someone of your stature who is in this industry has the story behind, and you just touched on it very minimally. It's an extremely personal one because you unfortunately witnessed your mom go through and lose her battle to breast cancer, and then you underwent genetic testing yourself and found out that you had the BRCA2 gene. I mean, where do you start this? I don't know how to unpack this. Tell us a bit about your mom and then how her lifestyle or what happened to her impacted your journey.
Yeah. So I think firstly, I think I must, you know, my mom, and I'm not just saying everybody feels this way, but my mom was a phenomenal woman. She was a nurse, and she eventually went into a more admin role. And by the time she passed, she was the chief director of public health in Pretoria. So she was hardworking and driven. My mom literally worked until a month before she passed away. So she never gave up. She always fought, and she was incredibly strong. So, you know, not only in my career, but in life, she also motivated me a lot because she was such a strong woman. There were many times towards the end where she was in excruciating pain. And I would tell her, you know what, you can take a little bit more than Panado, it is cancer after all, you know. So she always said to me, the day I need the morphine, I want it to work. So she was incredibly strong, and I think that pushed me. But having said that, when she passed away, I was ready to give up. I didn't see the point of me continuing. I was already a registrar in plastic surgery, but I just didn't feel without her being there, why am I doing this? You know, because I was doing it for her. But I think having lost her then also gave me the strength and opened my eyes to the way I viewed patients, their struggles, their battles. I saw a lot of neglect happen while my mom was in hospital. And this also pushed me to want to go forward and be a better doctor, you know, to do things better for women like her. So having also an extremely strong family history of breast cancer is what pushed me. My mom's mother and them were 14 children. Wow. And in their generation alone, there's no fewer than 5 or 6 women with breast cancer. There's also linked cancer amongst the men. And in my mom's generation, I think there are about 10 cousins that have it. Wow. So when it came to my generation, there's one second cousin, and then I had another second cousin who died of a prostate sarcoma at 35. Wow. So literally all of this pushed me, all of this motivated me, and everyone always said, oh, you're so strong for doing this. And I said to them, well, it's not so much about strength. I watched my mom die. She didn't one day suddenly have a heart attack or go to bed and not wake up the next morning. It was a process of suffering. And I didn't see myself going through that. And I was getting older. I haven't had children, which is also a risk factor. And so when I turned 35 and I started seeing younger and younger patients come through our breast clinic, the red light started going on. And I thought, you know what, I've always suspected that there's just too many people in the family that have it. And yeah, so I was 35 at the time when I went for the test, at the end of November. Got my results early in January, and I can tell you now, as much as you prepare yourself, as much as you think is the day you get your results, I was devastated. You know, I just burst into tears, and you think, there goes your fertility, there goes your womanhood. What do I do now? I know the results, so now I have to act.
Yeah.
So it was a very painful process, you know, mastectomies, but prior to my mastectomies, I was on hormone treatment so that I could save eggs. So all of that was done. Then I had my mastectomies, and when I did the mastectomies, they actually found abnormal tissue in both my breast and both my nipples. So I actually really made the right decision. I was on my way to getting breast cancer. And the January of that year, I had a normal MRI. So the pathologist said to me, you know, they found it because of me going for prophylactic treatment and them doing extensive studies on the sample, whereas it will only have been picked up on imaging once it was on an established cancer, and not necessarily too late, but I would have undergo chemo and surgery and all of that. So now it was just a surgery, but I was healthy and I was fit, and it was a conscious decision. It wasn't a choice of, oh, I've got cancer, I have to do this. I had to make a decision, a proactive life decision.
Yeah. Well, wow, it's just absolutely mind blowing when you listen to that. And here you are. It's just remarkable. Speaking of that proactive decision, you chose to have the bilateral preventative mastectomies and immediate breast reconstruction. And then I immediately thought about how your journey aligns a lot to celebrity Angelina Jolie's journey. Because to be really honest, a lot of us, I think, when it comes to breast cancer growing up, maybe in my community as a kid, it was a very hush topic, very shrouded in controversy. People very taboo, and you're like, whisper the C word. So I know of people, but I didn't really until in my 20s. I'm like, oh, Auntie Sally, you know, so and so had breast cancer, and Angelina being the celebrity, and when she underwent it, I was so happy for her. But I also got a greater understanding that the BRCA gene, you know, it can be removed, and she did this for her life, and she had her kids and all of that. So I just thought, you know, inevitably your proactiveness actually saved your life, and it's given you this healthy lifestyle right now. Unfortunately, many women don't follow through on those kind of things, you know, and it's really sad. It really is.
It's a very difficult thing because for most women, and I'm talking now about patients sort of in the prophylactic category as well as patients who have established cancer, it's a very difficult thing to tell a woman you're taking your breast off, and especially younger patients. And this is the scary thing, because we are seeing younger and younger patients. I mean, around an average of like 33, 34. And, you know, a lot of them are in the position I wasn't married. I didn't have a family, you know, to try and tell this woman, okay, you need to find a husband. Without your breast, you'll never be able to breastfeed your children. It's a very, very difficult, emotional, psychological thing to deal with as a woman. So there are even patients with cancer that opt for less aggressive treatment. They go for lumpectomies, or some, you know, just go for radiation and chemo. They don't want to follow through with the surgery. So it is a very sensitive topic, and it is a difficult point to drive home as well. Yeah. But it's thanks to shows like this and awareness programs that actually change people's minds, people's perception. Destigmatizing breast cancer is actually what we need to do. We need to make a woman know that she's okay, she can have a full life without her breasts. I've done it now for 2 years without my breasts. You know, I've had reconstruction, so nobody knows, you know, nobody meets me and says, oh, are those your boobs? You know, it doesn't happen that way.
And it also shows, define who you are, because you're more than just all of that. You're more than your cancer. And it's not, like I said, I was very intrigued. I was so proud in so many ways reading your story, because I thought, here you are, you really are a champion for what you're doing, and you are in that specific speciality. And I think so many women are going to benefit from you. So I was so excited to have this conversation with you. And I think we're talking about like destigmatizing. A lot of it has to do with giving women that dignity back. And hopefully they go for these, like women like myself who's been growing up in a very conservative community. I was almost too afraid to tell my mom, have you ever had your breasts checked? And she's never had a mammogram. And now I'm like shouting at her for all these years, Mom, you should have been more responsible. Things even like pap smears, things that I had to learn about it from friends. And I'm so glad I did it. And I'm so even more glad that I did this Optiphi test, because it's what pushed me. I have a birthday weekend coming up, and I'm like, hold on, I don't care if it's a birthday or not. I'm in my 40s now. I need to get this done. I really hope more women think like you. Tell us about this month as a practitioner, Breast Cancer Awareness Month. Obviously, it's something that's very close, literally, to your heart. How do you feel about it, and how can we get more women being proactive?
I think it's a very important, you know, breast cancer is an everyday thing. It's not just an October thing. But I think what this whole awareness month highlights is almost kind of, it gets more people talking, it gets more people knowledgeable, it allows more women access to, because there's often a lot of drives that could women that don't have the resources to go for treatment. So it's 1 month out of the year that we just sort of generate a lot more activity around the subject. And I think the important thing still boils down to basics. It's about educating the public, educating women. You know, the importance of a self-exam can't be expressed enough, because I can tell you, as a plastic surgeon, I'm not necessarily the first person to pick up the cancer. Often I only get involved at the reconstructive end. But having done a lot of cosmetic breast, I'll see patients at follow-ups. Or I recently had a patient, I operated on her daughter, and then she came to me because she actually wanted me to make her breast bigger. And on examination, I said to her, you know, she said to me, no, she thinks the previous implant she had is leaking. And I said, this is in your breast. It's not your implant. I need you to get an urgent sonar and biopsy. So I do also primarily pick up, and some of those patients will tell me, oh, I was in the shower and I'd heard something about self-examination, so I thought, let me do it. So the more we talk about it, the more okay it will become for women to do these things, because the tests are there, but not everybody has access to the tests financially. But something as simple as a self-examination at least gives a woman an indication that I need to proceed. You know, I need to put money that I have aside and I need to get myself tested.
And I think if they know more women like yourself who've come through the story, I think it's that fear of the unknown. Like me, I'm not even lying. I'm freaking out. Every time I go for a pap smear, I don't want to answer my cell phone because the doctor will say, if you don't hear from me, just wait. And you don't want to manifest like those kind of thoughts. And I think for many women, it's just the fear. But I'm really am so glad that there are people like yourself encouraging it. You were talking about very young women. If we can dispel some myths, at what stage or what age does breast cancer affect people?
Well, I think it still remains a very controversial issue, because if you look at sort of global trends, it's still sort of seen that, you know, in some places they only will let a woman have a mammogram after 50. South Africa, medical aid rules, it's over 40. Unless you have a high risk, so family history, a significant family history, which is what happened with me. The day my mom was diagnosed with breast cancer, I was 18, you know, so I started going for checkups then already. I didn't get mammograms until I turned 35. So I would get a breast sonar every year, but not a mammogram. And, you know, some of these radiologists are amazing. They can see so much on a sonar that it's not always necessary for a mammogram. And a sonar is less invasive, it's not painful, and it's cheaper than a mammogram. So it's about getting the basics, but it's very difficult to give you that answer, Sareshni, because I think we still know most breast cancers are still sporadic cancers. Familial cancers aren't the majority of the breast cancers that are out there. So I think it's about awareness. So it's important for girls to examine their breasts, because the big thing is change. So if you feel your breast regularly, when something feels different or is wrong, you will notice it. So that's the most fundamental basic thing, because you can do it at any age. We should be teaching, you know, girls that have gone through puberty to examine their breasts. It can start as young as that.
So I have a 10-year-old, and one of the things that I'd researched about is doing the HPV vaccine. I've worked out, and she's had her first half, and the second half is in December. Although she hasn't started to grow from a puberty perspective as much, I'm very open in saying her this is what a healthy breast looks like. And I think also if you as a parent or a guardian can engage in that way and explain to children to understand what their body should look like, it would be the perfect thing, because that's how these kids can break through that taboo, not being afraid of understanding their bodies. And maybe when things are wrong, they don't wait for like 20 years later, like, something didn't look right. Thank you so much, Doctor. We'll come back to you in the next few minutes, but let me quickly catch up with Dr. Sam. Dr. Sam, wonderful to chat to you again. It's been great. We've been having this, we had a catch up the last time, so it's really good to see you. I was chatting about Optiphi, and obviously this is where you come in. If you can quickly update people about your background with Optiphi, and so that we understand why it is I had to catch up with you specifically.
Oh, great. Thank you so much. So it's really nice being back. And basically just to give you a bit of a background. So I am the head of genetics at Skin Rejuvenation Technologies, which is the holding company for Optiphi. And we have a DNA testing laboratory there where we focus on DNA testing for skin health, diet, hormone, and breast cancer.
So I did this particular Optiphi Helix breast, ovarian, and prostate cancer risk test. And again, I'm so glad that Optiphi was so kind, first of all, to send me one of these tests. And I didn't understand the impact of the test until I got the results. And having the conversation with the doctor was, first of all, very scary. But at the same time, she assured me, it said, Sush, due to my family, and like how Dr. Volkwyn mentioned, the familial history, I am somebody that's in the risk section. And it's something that I should really go ahead and look. Like I said, I do have family members who have breast cancer, and I never thought to do it. This particular test is associated with the development of breast cancer, these markers, and some of the markers are also associated with increased risk for ovarian and prostate cancer. Could you explain from a technical point what that test enabled for someone like me, what exactly I went through?
Okay, so obviously you'll know from experience, you had to do that swab, and then we extracted the DNA from that swab. And when we have the DNA, we then either use sequencing or genotyping technologies to be able to identify potential genetic variations, or what we refer to as mutations, in your genetic code. Now, based on the presence or absence of certain variations in a person's DNA, we are then able to evaluate their potential risk for a particular concern. So in your case, with the Optiphi Helix breast, ovarian, and prostate cancer risk test, when we looked at the variations, we looked at variations across 7 different genes, including the most common BRCA genes or BRCA genes. And it's very important to look at several genes in this test, as breast cancer is considered to be polygenic in nature. So what that means is that it involves more than one gene. So that's why we have to look across a broad spectrum. And it is also known that having some of these variations, particularly within the BRCA genes, could also then lead to an increased susceptibility in ovarian cancer for women and prostate cancer for men. So we evaluated all of the variations we found, and then the combination of those variations would then indicate to us whether a person has a low, medium, or high potential genetic risk for these cancers.
Mm-hmm. Now, when going through the test and having the conversation with yourself as well as the doctor that was associated with the test, she spoke about the word mutations. And I think when patients hear the word mutations, they imagine the worst, because oh, something's gone wrong in this whole DNA. Why is it me? And I'm not going to lie, it's one of the things that really freaked me out. And I did what all people do. I went to Google. Big mistake, because then you start to self-diagnose, and then you freak out even more. So took a deep breath. But when people hear words like mutations, could you tell us what it is a mutation means, and also a little bit about that BRCA 1 and 2 gene?
So basically, mutations are small variations that occur in someone's DNA or your genetic code. And these variations can then obviously impact the functioning of a certain gene. So for example, if we look at the BRCA genes, the predominant role actually of several genes involved in breast cancer is mainly related to repairing DNA damage that occurs. So if you have a variation in one of these genes that impacts how that gene functions, it's going to eventually impact the repair process. Yeah. And this makes you more susceptible to accumulating DNA damage and then becoming more vulnerable to certain types of cancers. Yeah. And we also know that mutations can be passed from one generation to the next. So detecting these variations in your genetic code can then give you insight if you are in the higher risk category.
Yeah, and I found it so fascinating, because now I'm very curious about the genes my daughter carries. And immediately I was like, and I think this whole test really alerted me. I'm so glad that it, because it enlightened me on a level where I was now comparing, I wish my mom was educated in this, or given this kind of information or access to information. I think it will make such a massive difference to her life. But for now I feel like my consciousness has been activated. I'm now so aware, which is why I'm trying to be a bit more proactive, talking about breast cancer, making my daughter aware, this is what women go through during puberty, and as we get older, etc., and not create this stigma and this worry of you can't talk about stuff like that. So really, it's a phenomenal test, and I highly recommend it. I feel it's like a groundbreaking catalyst for women to go and have mammograms like myself for the checkups. Some, of course, like I said, have this incredible fear of the unknown, and that fear can prevent the early detection of cancer. I really, really believe that. Do you think we are winning this war against early detection and rolling out of testing?
I feel as though we are definitely making progress, but as you mentioned, sometimes people's fear, it can get in the way. And sometimes this fear also stems from a lot of misinformation. So therefore, I can't stress enough how important it is to know the fact that any genetic breast cancer test is not a diagnosis. It is rather just an instrument to determine one's potential future risk. So just because you have a risk mutation, it doesn't mean that you'll necessarily get breast cancer, and vice versa. And that's why it's so important to correctly interpret these results, and why all risk factors need to be assessed by the practitioner. Because as Dr. Volkwyn was also saying, you know, there's so many factors involved in the whole process, and you know, when she made her decision, it wasn't just because of the genetic results. It was a strong family history and other factors as well. And so elevating our own awareness of our own risk can be so beneficial, and it doesn't actually need to be a scary thing at all. I mean, we can all gain from making better lifestyle choices in the end.
I found myself in the right age group, in the right category, and what I love about the test was just the education around it. And so exactly like you said, it's not a diagnosis, but for me, it just felt like this gave me that push that I needed. Like, Sush, you know what? Go and have a look at lots of things. And I did 2 different tests. And what I've loved is that I've adopted a new health lifestyle. I made sure I had better conversations, more conscious conversations with my gynae, did my pap smear, got to understand that my body is going through its own little crisis. And I'm so glad the Optiphi tests, whether it's for my health and my diet, etc., have just helped me align better. And I feel like I now get it, you know, and I think it was like this wonderful light bulb moment in my life. So yeah, I'm on track.
So glad.
From an Optiphi side, tell us about some of the exciting developments. Are there any new exciting things happening in your program? And what are some of the things you would recommend? And you could just walk us through for those women and men who are interested in taking any of the Optiphi tests, because you guys are more than just skin, actually.
Yes, so in terms of Optiphi as a whole, we're obviously always innovating at Optiphi. So we do have several exciting products and technologies that we'll be launching in 2021. I can't say too much about it, but what I can say is that at Optiphi, we really strive for a concise and focused range. So for 2021, we're also concentrating on merging the most innovative technology and ingredients into our existing products. And we really want to remain at the forefront of novel developments in both skincare and genetic testing.
Fantastic.
So if people do want to know a little bit more about the testing, they can obviously then visit our website.
Fantastic. Okay, before we come back to you to say goodbye, Dr. Liana, let's come back to you quickly as we wrap up the conversation. Your thoughts for 2020? I know that we're looking forward to a much more, hopefully positive. Yes, we've got to be positive. We've got to manifest positive thoughts. I really believe in that. So 2021, your thoughts, how do you want to see women in this particular area, thinking about their breast health, etc. And also, how can people get a hold of you, be it for reconstruction surgery or just to have conversations like this with you?
Well, I think, you know, seriously, to be honest, I think 2020 has been such a difficult year, like an incredibly difficult year for everybody. But I think my hope every year is that we will detect a few more earlier cancers, and that, you know, manage both from a treatment level, prophylactic level, that modalities just improve and we can give patients a better mortality rate and better morbidity rates, improve their quality of life. Because the inevitable is there, you know, we all are going to pass away eventually. But my big thing in this whole cancer struggle is how would we die? Like I said, if we can alleviate some of the women's suffering, and also just to destigmatize, once again, as I'd mentioned, going for mastectomies, having reconstruction, you know, you can still live a full productive life without having your breasts.
Fantastic.
It's not imperative to have them. And then as far as contacting, I have 2 practices. I work at the Life Brooklyn Day Hospital in Pretoria, and I also work at the Centurion Day Hospital, also in Centurion. So patients can just Google the 2 clinics and they'll be able to find me.
Oh, it's been so amazing chatting to you and getting to know your journey, and we wish you everything of the best in the coming years, and I can't wait to see you progress in this field and just get more and more people aware of your talents and expertise. So thank you so much for joining us. Dr. Sam, how do people get a hold of you, and particularly with trying out the Optiphi test?
So they can visit our website at www.optiphi.com, or alternatively, they could email us at dnalab@optiphi.com, and we're happy to help.
Oh, thank you so much. Thank you very much, ladies. I really appreciate the conversation. And thank you for getting this conversation started. It is Breast Cancer Awareness Month, but like Dr. Liana said, it's not just for the month of October. We need to be aware of this all the time. So thank you very much. And I really, really appreciate your time.
Thank you.
Thank you.
Bye.
Okay, bye-bye.
Cheers. Bye.